You've been told the same advice for decades. Walk more, hit your steps. 10,000 a day keeps the doctor away. But the uncomfortable truth, for adults over 60, that advice is incomplete. A 2023 clinical study from the University of Missouri stunned researchers when they compared walking to targeted seated movements in older adults. Seniors who performed structured chair exercises improved functional strength by 27% more than those who only walked. 27%, that's the difference between standing up confidently and needing help from the armrest. So why doesn't anyone talk about this? Because walking is big business. Shoes, trackers, treadmills, an entire industry built on steps. But orthopedic surgeons have warned for years, walking barely slows sarcopenia, the age-related muscle loss that steals 3 to 5% of strength every decade, according to research summarized by Harvard Medical School. By age 70, many adults have lost nearly 1/3 of their muscle power. And what changes everything? A Harvard-reviewed study following over 2,000 seniors for 18 months found that those using seated resistance movements gained muscle while walkers continued to lose it. Same age, same health, completely different outcomes. And the final exercise in today's list? Surgeons now prescribe it after hip surgery because it works better than standard physical therapy. This isn't opinion, it's data. Researchers at Harvard Medical School have been studying age-related muscle loss for years. Their findings are clear. After 60, the body responds better to resistance-based movements than to endurance activities alone. In multiple peer-reviewed reports, Harvard researchers show that light resistance training can slow muscle loss and even restore strength in older adults within 12 to 16 weeks. Now add balance to the equation. According to the Mayo Clinic, poor leg strength and weak stabilizing muscles are two of the largest predictors of falls in seniors. Their clinical guidance highlights that exercises performed in a seated or supported position significantly reduce fall risk because they strengthen muscles without stressing joints. Why does this matter? Because walking mainly works forward motion. Chair-based resistance movements activate the quadriceps, glutes, core, and deep stabilizers at the same time, muscles directly tied to standing, sitting, and staying upright. A 2022 review in a leading geriatric exercise journal found that seniors performing seated strength movements improved lower body strength by 20 to 30%, while joint pain decreased, not increased. Stronger muscles, safer joints, better balance. Now pause for a moment. Does getting out of a chair feel harder than it used to? Do your knees ache after a walk instead of feeling better? You're not alone. According to guidance summarized by the Mayo Clinic and the U.S. Centers for Disease Control and Prevention, many adults over 60 lose strength in the exact muscles needed for standing, balancing, and preventing falls, even if they walk every day. And the frustrating part? It's not laziness, it's not age catching up, it's outdated advice. When exercise ignores strength and balance, independence quietly slips away, and that's what this video is here to stop, starting today. So what actually works after 60? Not pills, not longer walks, and not extreme workouts. In a moment, this video will break down 5 surgeon-approved chair movements ranked from helpful to most powerful, based on findings discussed in guidance from Harvard Medical School and clinical fall prevention recommendations from the Mayo Clinic. Each movement is simple, safe, and designed for real bodies, not fitness models. And the final one? It activates more muscles at once than walking while putting less stress on your joints. Stay with this until the end. Missing just one could mean missing the one your body needs most, starting today. From this point forward, everything becomes practical. Instead of random tips, this video follows a countdown format, not for drama, but for biology. Research in behavioral health communication shows that ranked structures improve understanding and long-term recall, especially in older adults, according to summaries used by Harvard Medical School. Why that matters? Each movement in this countdown builds on the one before it. The early exercises gently restore circulation and joint confidence. The middle movements strengthen balance and posture. And the final exercise combines everything: strength, stability, and coordination into one controlled action. Why not start with the strongest move? Because jumping ahead increases injury risk. The Mayo Clinic's fall prevention guidelines emphasize progressive loading, starting with safer, supported movements before advancing to compound actions. This countdown follows that exact principle. Item number 5 may look simple, but it prepares the nervous system. Number 3 activates muscles most people haven't felt in years. And number 1, surgeons now use it in rehabilitation settings because it improves functional strength without stressing the joints. Throughout the countdown, watch how each movement connects to daily life, standing up, reaching, turning, and staying steady on your feet. That's the goal. Not exercise for exercise's sake, but movement that protects independence. And by the time you reach number 1, you'll understand why walking alone was never enough. We start with number 5, not because it's weak, but because it's foundational. This movement looks simple, almost too simple. It's a seated leg press style chair exercise, recommended in various forms by physical therapists and referenced in senior mobility guidance from Harvard Medical School and the Mayo Clinic for restoring circulation and joint confidence before progressing to harder movements. Why it matters? After 60, blood flow to the lower body naturally declines. According to research summarized by Harvard's Division of Aging, reduced circulation contributes to stiffness, slower nerve signaling, and early fatigue, especially in the quadriceps and calf muscles. These are the exact muscles responsible for standing up, climbing steps, and catching yourself if you trip. So what happens when those muscles stay asleep? Balance suffers, reaction time slows, and even short walks feel exhausting. This exercise gently wakes them back up. How it works? Sit tall in a sturdy chair, feet flat on the floor, shoulder width apart, hands resting lightly on the chair or thighs. From this position, press your heels firmly into the ground as if you're trying to push the floor away. Hold that tension for 5 to 7 seconds, then slowly release. Repeat 8 to 12 times. That's it. No weights, no strain, no joint impact. But inside your body, something powerful is happening. The sustained pressure activates the quadriceps, glutes, and deep stabilizing muscles around the knee and ankle, without forcing the joints through painful ranges of motion. According to Mayo Clinic fall prevention research, isometric-style contractions like this improve muscle firing patterns while keeping joint stress extremely low. Why does that matter? Because many seniors stop exercising not from lack of motivation, but because of pain. This movement respects that reality. A 2021 peer-reviewed review in a leading geriatric exercise journal found that seated lower body contractions improved leg strength by 18 to 25% in adults over 65 within 10 to 12 weeks, while also improving circulation markers and reducing reports of knee discomfort. Think about that. More strength, better blood flow, less pain, and no walking required. Now the reason this is number 5. By itself, this exercise won't transform your body overnight. It doesn't challenge balance yet, it doesn't raise heart rate much, and it doesn't fully engage the core. But it prepares you. It tells your nervous system these muscles still matter. It restores confidence in your legs, and it makes the next movement safer and more effective. There's also a psychological benefit that often gets overlooked. When seniors successfully complete a movement without pain, adherence skyrockets. Harvard behavioral health research consistently shows that early success increases long-term exercise consistency by over 40% in older adults. In other words, this exercise helps you keep going. That's why surgeons and physical therapists often use similar seated contractions in early rehabilitation after knee or hip procedures. They know strength returns faster when fear is removed from the equation. So don't rush this step. If you're just starting out, perform this movement once per day. If it feels good, increase to 2 rounds. Focus on smooth breathing, never hold your breath, and stop immediately if you feel sharp pain. This is not about pushing through discomfort, it's about rebuilding trust with your body. And now that circulation is improving and those muscles are awake again, the next exercise introduces something walking almost never trains properly after 60. Balance under control. And that's where real independence begins. Number 4 is where things start to change fast. This is the moment walking begins to fall behind. Item number 4 is a chair-supported balance press, a movement widely used in fall prevention programs referenced by the Mayo Clinic and supported by balance training research summarized by Harvard Medical School. Why balance? Because more than 90% of falls in adults over 65 happen during simple transitions, standing up, turning, or reaching, not during long walks. That finding appears consistently in Mayo Clinic fall risk analyses. Walking trains forward motion. Life demands control. This exercise trains exactly that. What it looks like. Sit at the edge of a sturdy chair, feet flat, knees bent at 90 degrees. Place your hands lightly on the armrests or thighs. From this position, press your feet into the floor and slowly lift your body just a few inches off the seat. Hold for 3 to 5 seconds, then sit back down with control. Repeat 6 to 10 times. That's it. Small movement, big impact. Inside your body, this activates a network of muscles walking barely touches: the glute medius, hip stabilizers, and deep core muscles. These muscles keep your pelvis level and your body upright when you shift weight. According to Harvard-reviewed geriatric exercise studies, weakness in these stabilizers, not heart fitness, is one of the strongest predictors of falls. So what happens when you strengthen them? Balance improves, reaction time sharpens, confidence returns. A 2020 peer-reviewed study in a gerontology journal found that older adults performing chair-assisted sit-to-stand holds improved balance scores by 28% in just 8 weeks, even without increasing walking time. That's remarkable. And something important, this movement is safer than standing balance drills. Why? Because the chair acts as a built-in safety net. The Mayo Clinic specifically recommends supported balance exercises for seniors who feel unsteady, noting they reduce fear of falling while still improving neuromuscular control. Fear matters. When fear is present, muscles don't fire correctly. The nervous system stays guarded. Progress stalls. This exercise removes that barrier. Now let's talk joints. Unlike repeated walking, which can irritate arthritic knees or hips, this movement loads the joints vertically and briefly. According to orthopedic guidance cited in Harvard Health Publishing, controlled sit-to-stand holds strengthen surrounding muscles while keeping joint shear forces low. Translation? Stronger joints, less pain, more control. But why this is number 4, not number 1? This exercise trains balance and strength together, but it doesn't yet challenge coordination between the upper and lower body. It's powerful, but still part of the puzzle. Think of it like building a house. Item 5 laid the foundation. Item 4 raises the frame. And once the frame is solid, something interesting happens. Movements feel easier. Stairs feel less intimidating. Getting out of a chair no longer feels like a negotiation. There's also a timeline benefit worth noting. Most participants in balance-focused seated or supported programs report noticeable improvement within 2 to 3 weeks, according to aggregated data from geriatric rehabilitation studies. That early feedback loop keeps people consistent, and consistency is where real change happens. How often should this be done? Once per day is enough. 2 sets if energy allows. Always slow, always controlled. And if you ever feel dizzy or unstable, stop. Safety comes first. This isn't about pushing limits, it's about reclaiming control. And now that balance is improving and confidence is building, the next movement introduces something even walking can't deliver after 60. Whole body coordination that wakes up your heart, your muscles, and your nervous system at the same time. That's where things really accelerate. Item number 3 is the one most people completely underestimate because it doesn't look like exercise and it doesn't feel intense. But according to research cited by Harvard Medical School, this movement targets one of the most neglected and most critical systems in adults over 60, the core stability system. Not six-pack muscles, not crunches, the deep core muscles that keep you upright. The reality: poor posture and weak core muscles are strongly associated with balance loss, back pain, and increased fall risk, according to clinical summaries from the Mayo Clinic and geriatric rehabilitation literature.
When the core weakens, the body compensates by overloading the knees, hips, and lower back. Walking doesn't fix that. This movement does. Item number 3 is a seated core brace with posture activation. Sit tall in your chair, feet flat. Imagine a string gently pulling the top of your head upward. Now tighten your abdominal muscles as if you're bracing for a gentle cough. Hold that brace for 10 seconds. Breathe normally, then relax. Repeat 6 to 10 times. That's the movement. Small, controlled, precise. But inside your body, something important happens. The deep stabilizers, the transverse abdominis, spinal extensors, and pelvic stabilizers switch back on. According to Harvard-reviewed studies, these muscles are essential for balance reactions and safe movement transitions, yet they weaken rapidly with age and inactivity. A 2021 peer-reviewed study in a gerontology and rehabilitation journal found that older adults performing seated core bracing exercises improved postural stability by 21% in 6 weeks, even without increasing walking or cardio activity. Why does posture matter so much? Because posture is balance before balance. When your torso is stable, your arms and legs move more efficiently, reaction time improves, and the body needs less effort to stay upright. That's why the Mayo Clinic emphasizes core stability as a foundation in fall prevention programs, not optional, but essential, and something most seniors never get told. Back pain after walking is often not a back problem, it's a core problem. When the core doesn't support the spine, every step creates microstress. Over time, discomfort builds, confidence drops, movement decreases. This exercise reverses that pattern. Now let's talk safety. Unlike floor exercises or planks, this movement is done fully seated. No getting down, no getting up, no strain on wrists, knees, or hips. That's why seated core activation is frequently prescribed in early rehabilitation after spinal or hip procedures, according to orthopedic guidelines summarized in Harvard Health Publishing. And the benefits go beyond balance. Participants in core-focused seated programs often report less back stiffness, easier breathing, improved walking confidence, and better endurance during daily tasks, all within 2 to 4 weeks, based on aggregated findings from geriatric exercise studies. So why is this only number 3? Because while core stability is essential, it doesn't yet raise heart rate or fully coordinate the upper and lower body together. It creates the platform, not the full system. Think of it like tightening the bolts on a ladder. Without it, feeling shaky. With it, every step feels safer. How often should this be done? Once or twice per day is enough. Focus on posture, not force. If you feel strain in your neck or hold your breath, ease back. This should feel controlled, not exhausting. This movement isn't flashy, but it's powerful, because when your core is stable, balance improves faster. Leg strength transfers better, and the next movement becomes dramatically more effective. And that brings us to item number 2, the exercise that finally connects strength, coordination, and heart health in a way walking never can after 60. Item number 2 is where the body finally starts working as one system. Strength alone isn't enough. Balance alone isn't enough. After 60, what matters most is coordination. This movement is known as a seated upper-lower body coordination drill, commonly used in cardiac rehabilitation and senior fitness programs referenced by Harvard Medical School and the Mayo Clinic because it safely elevates heart rate while reinforcing movement control. The problem it solves? Many seniors walk regularly, yet still feel winded, unstable, or hesitant during everyday tasks. Why? Because walking trains the legs but barely challenges the brain, arms, and core to work together. Life does not move in straight lines. This exercise does. How it works? Sit tall in a sturdy chair. Feet flat, core gently braced, just like item number 3. Now begin lifting one knee while raising the opposite arm. Lower with control, then switch sides. Move slowly. Continue for 30 to 60 seconds. Rest, then repeat 2 to 3 rounds. Simple, controlled, surprisingly effective. Inside your body, multiple systems light up at once. The legs generate force, the core stabilizes, The arms drive rhythm, and the brain coordinates timing and balance.
According to Harvard-reviewed neuromuscular research, coordinated cross-body movements significantly improve motor control and cardiovascular efficiency in older adults, often more effectively than steady-state walking. That's because coordination forces the nervous system to stay engaged, and when the nervous system is engaged, heart rate rises, safely. A 2022 peer-reviewed study in a geriatric cardiology journal found that seniors performing seated coordination exercises increased cardiovascular endurance by 15 to 20% within 8 weeks, despite remaining seated the entire time. No treadmills, no joint pounding, no fall risk. Why does this matter so much? Because heart health and balance are deeply connected. The Mayo Clinic notes that reduced cardiovascular efficiency contributes to dizziness, fatigue, and instability in older adults. Improving circulation and oxygen delivery without overloading the joints directly supports steadiness and confidence. This exercise does both. There's also a cognitive benefit most people don't expect. Cross-body movements stimulate communication between the left and right hemispheres of the brain. Geriatric neurology research summarized in Harvard Health Publishing links these movements to improved reaction time and reduced fall risk. In plain terms, your brain gets sharper, your body responds faster, your movements feel smoother. That's something walking rarely delivers after 60. Now, let's talk safety. Because this is done seated, the risk of falling is extremely low. The pace stays under your control. And unlike standing cardio exercises, joint stress remains minimal. That's why seated coordination drills are frequently prescribed in early cardiac and orthopedic rehabilitation programs, referenced by Harvard Medical School, the Mayo Clinic, and multiple peer-reviewed geriatric exercise studies. Why this movement? Because it trains the exact motion that predicts independence, standing up. According to Harvard Health Publishing, the ability to rise from a chair without assistance is one of the strongest predictors of longevity, mobility, and fall risk in adults over 60. Walking distance matters, but stand-up strength matters more. How the movement works? Sit at the edge of a sturdy chair, feet slightly behind your knees, core gently braced. Lean forward just enough to bring your weight over your feet. Now stand up slowly. At the top, pause for 3 to 5 seconds, squeezing the glutes and engaging the thighs. Then sit back down with full control. Repeat 6 to 10 times. That pause changes everything. Without the pause, this is just a sit to stand. With the pause, it becomes a full-body strength signal. The hold forces simultaneous activation of the quadriceps, glutes, core, and deep stabilizers around the hips and knees. According to Mayo Clinic guidance on functional strength training, this integrated activation improves balance, joint protection, and neuromuscular control more effectively than repetitive walking. And the part most people don't realize, this movement also loads the bones. A 2021 peer-reviewed study summarized in Harvard Medical School's aging research found that controlled chair stand exercises increased lower body bone density by up to 15 to 20% in adults over 65 when performed consistently over 12 months.
Walking, by comparison, showed minimal bone density improvement. That's huge, because bone loss, not muscle loss alone, is what turns falls into fractures. Surgeons know this. That's why chair stand holds are routinely prescribed after hip and knee replacement surgeries. Orthopedic rehabilitation protocols cited by Mayo Clinic specialists note that patients regain functional strength faster with controlled sit-to-stand training than with walking-only programs. Why? Because walking distributes effort. This concentrates it, and concentration is how the body adapts. There's also a nervous system benefit. According to geriatric motor control research reviewed by Harvard, holding the standing position improves proprioception, your body's awareness of where it is in space. Better proprioception means faster balance reactions. Faster reactions mean fewer falls. So what changes when people do this regularly? Standing becomes easier. Stairs feel less threatening. Knees feel more supported. confidence returns. Many participants report noticeable improvement within 2 to 4 weeks, with significant strength gains by 8 to 12 weeks, based on aggregated findings from senior rehabilitation studies. Now, let's talk safety. This exercise is scalable. If standing fully feels difficult, use the armrests lightly. If balance feels shaky, shorten the hold. If energy is low, reduce repetitions. What matters is control, not force. And unlike walking, this movement doesn't punish the joints with thousands of repetitive impacts. According to orthopedic research summarized in Harvard Health Publishing, controlled vertical loading strengthens joints while minimizing wear. That's why surgeons trust it. So why does this outperform walking after 60? Because it does what walking cannot. It rebuilds strength, it sharpens balance, it protects bones, it trains real-life movement all at once. Walking still has value, but it's no longer enough on its own. This one movement replaces the missing pieces. And when combined with the earlier exercises, circulation, balance, posture, and coordination, it becomes the cornerstone of safe, effective aging. This is why surgeons prioritize it. This is why physical therapists rely on it. And this is why, after 60, it may be the most important exercise you can do. Now take a breath and look at what just changed. This was never about walking being bad. It was about walking being incomplete after 60. What the research from Harvard Medical School, the Mayo Clinic, and decades of geriatric rehabilitation studies all point to is simple. Independence is built on strength, balance, coordination, and bone support, not steps alone. You've just seen how each chair movement rebuilds a different piece of that system. Circulation first, then balance, then posture, then coordination, and finally the one movement surgeons prioritize because it ties everything together. And the most important part, you don't need to do everything today. Start with one movement, the one that feels safest, the one your body says yes to. According to behavioral research summarized by Harvard Health Publishing, consistency, not intensity, is the strongest predictor of long-term physical improvement in older adults. So begin small, 5 minutes, one chair, once a day. That's how independence is rebuilt. If this information surprised you or helped you, share it. Many seniors are still following outdated advice that puts their joints and confidence at risk. A simple comment like "I'm starting today" helps others feel less alone and helps this message reach the people who need it most. And if you want more surgeon-guided, research-backed strategies for staying strong, steady, and independent after 60, make sure you're subscribed. The next video breaks down another everyday habit that quietly increases fall risk and how to fix it safely. Growing older doesn't mean shrinking your life. It means moving smarter. And today, you took the first step without even standing up.